call a question.
So we have Dr. Anant also who has joined. So this is going to be a great session because this was what everyone was asking, and really I am incapable and I don't have any personal experience of studying or even crossing the border for any ophthalmology related work. So I thought who will be the best people. So we have our speaker today, Dr. Soumya Narayanan. She has done her graduation, post graduation from Agarwal's Eye Institute, Chennai. And after this, she has done a fellowship in orbit oculoplasty at Moorfields. And she will be talking more about how to go about this international fellowship observership. In our panel today, we have two very experienced retina surgeon. We have Dr. Anusha from who will be joining from Kerala, and ma'am is my mentor, and she has post-graduated from the famous AIMS, and following that she has done her senior residency in AIMS, and she has of late done a fellowship in ocular oncology from the famous Moorfields Hospital, London. So she will again, if we have any doubts about how to go about cracking UK, so whatever questions you may have after Dr. Soumya speaks, you can just go ahead and other panelists which we have is Dr. Anand. So Dr. Anand Bhosle, again, he has passed out from GMC Aurangabad and he was just a year junior to me. So we have a pretty sour relationship, which we are trying to sweeten it out right now. And then we have, he has done his fellowship in retina from famous hospital Arvind Madurai. And this was followed by a long-term fellowship in Australia. So Anant is currently working in Kolhapur, Maharashtra, and he will be giving us more insight about Australia. So if any one of you have any questions regarding Australia after Dr. Soumya finishes, we'll go ahead. This is an interactive session. So I will, everyone can use their mic, okay, whenever they want. Till then, let us everyone mute. And shall we go ahead, Dr. Soumya? Dr. Anusha, Dr. Anand?
Sure, Anuj.
Please
Let's
go
start.
ahead. Thank you.
Okay, Soumya, please go ahead.
Okay. Thank you, Dr. Anuj, for this opportunity. And there is one small correction. I did my long-term fellowship in from Agarwal, Chennai, in oculoplasty, and I did a observership only in Moorfields. Okay. So good evening all, and welcome to the session. So today we are going to discuss about international fellowships and observership. So I'll be dealing in general, and later we'll have the discussion with our expert panels. So India is a country of huge population and we have a lot of eminent doctors and surgeons here. Then why should we think about an international fellowship? Because it will give you more opportunities. We can train with giants in the field of ophthalmology. We'll get wider perspectives. We'll see different work ethics and documentation style, and we'll be able to access to their library and articles. Also, as a person and also as a surgeon, we'll gain more confidence and we'll be standing out from our colleagues. So that is the only reason today Dr. Anuj called me for this discussion. And we'll develop cross-cultural competency and awareness, and we'll develop an international professional network. So before applying for a or thinking about a fellowship in outside, we should be clear about what specialty we want to choose and what are the best institute in the world for that, and who are the best mentors, and about also finance, whether we are able to go for non-funded fellowship or whether we can only go for funded fellowships, and how much time you want to invest in this training. So these are the main options: USA, UK, Australia, Canada, and Singapore, and few of the European countries also. So about the timing, so it's always better after a national fellowship. and even better when after practicing for a while. So you know what you are lacking and what extra skills you want to acquire and what is the need at your workplace. And also you have to start early because even 1 to 2 years before, and you have to track all the application dates of the institute where you want to apply, so you won't miss out. So these are the options. We can go for clinical fellowships, which will have hands-on training. You can go for research fellowships or observerships or ICO sponsored programs. Also, you can go for fellowships by APA or IOFF, and you can directly apply to few universities and hospitals. So clinical fellowship in general, actually, because we are going to touch the patients, we need a license to practice in that country. And also we have to show our language knowledge skill. And also usually it will, the duration will be around 1 to 2 years. We will definitely require a visa to go and work in other place. Usually it will be funded, and sometimes we have to self-fund. So about USA, we definitely require a visa. And the main problem with USA thing is that we need a completion of USA residency in most of the cases, and very rare hospitals only will take without a residency. And we have to acquire a license also, that is actually based on each the state medical law. And this is actually difficult for international graduates to obtain. But once you get this, it can lead to employment position within the United States. So the application process is known as SF matching in most of the cases, and very few hospitals directly take fellows. So SF matching, we can in the site we can check for the available options for fellowships, and they will describe about the fellowship and the eligibility and what is the timing of the application process and all. Everything they will be given in detail. And they have a central application service, so they will give you what all things we have to apply. And as the third point, you can see the letter of recommendation. So the letter of recommendation is very important for a international fellowship or observership, because that is like a recommendation from our mentor to the hospital, so that has a high value. About UK, about the clinical fellowships, you can apply search through the NHS job site, where you can give the title and where you want to apply, and you can see for the available options. So usually it will come, they will list the job like this, and when we open that, we will be able to see the specifications for each, what is the duty of the fellow, what are the qualifications we require, and what is the application process. So in everything, you can see a full GMC registration with license to practice in UK. So GMC registration is a must for clinical fellowship under NHS in UK. So how can we go for GMC registration? So we need our primary medical qualification to be acceptable by GMC. So you can check in their website whether our medical school is eligible or not. So if it is eligible, you can go through a EPIC verification. That is actually electronic verification. So that is that you can do. And we have to show our English proficiency with IELTS or OET, which has separate scoring system. And we have to pass the exam within 2 years of the GMC registration. And proof of clinical knowledge should be there. Either we can pass licensing exams like PLAB, USMLE, or postgraduate qualification like MRCS or MRCP. In that case, you should be aware that the MRCS, what we are getting after ICO exams, are not qualified for GMC registration, because we are not clearing any OSCE examination in that. And if you don't have PLAB, USMLE, or MRCS, etc., we can go through sponsorship route. That is known as MTI, or the Medical Training Initiative. So this is a dual sponsorship program where you have to get a sponsor from India and sponsor from UK. So the certificate of sponsorship from your mentor from India, and you have to find out a mentor in UK also. But all the UK mentors are not eligible for MTA. So in that case, we can apply through Royal College. So this after getting MTA, we can be in UK for maximum of 24 months. And that these all things are very long process. So that's why I told you have to apply very early. So next about observership or research fellowship. So there won't be any hands-on, no need of any local residency program. We have to get our personal finance support from our home institute or by ourselves. Some fellowships are paid and some are non-paid. and they are readily available and accessible. We can get up to weeks, 2 months to practice in that, to observe in that institution, and we need visa for this also. So you can directly apply to the hospital where you want to observe. And ICU fellowships are actually in way between the observerships and clinical fellowships, and it will decrease the burden of language knowledge test and also some GMC registration kind of things. So this is the eligibility for ICU examination. Have completed our residency and passed specialist examination in ophthalmology. We are of less than 40 years of age and from a eligible country like developing countries. We should return to our home country after training. And if the patient, if the candidate has passed one or more ICU examination, they will get a more weightage. So these are the options. They used to give 3-month fellowship in all specialty, or there are a special fellowship for glaucoma, retinoblastoma, and ocular genetics, and there is a research fellowship also. So you can see in their website, you can go for the host directory, and you can see which one is better for you, and you can start applying. So for application, you have to select a fellowship, upload your documents for the eligibility check, then ICO will review your eligibility, and after that you can directly apply to the host, and then the host will review your application and confirmation of the fellowship. So these are the few sponsored things. That APAO sponsorship, that is Asia Pacific Academy of Ophthalmology, that is for young ophthalmologists from developing countries. It's usually for 3 months to 1 year fellowship, and they will give a allowance of few US dollars, and preferably we have to complete one of the subspecialty training program available in the home country, and we should have publication. Other one is the International Ophthalmological Fellowship Foundation. They give 3 and 1 year fellowships and also research programs also. So sometimes you can directly apply to the institute like Sydney Eye Foundation and all. And before concluding, these are few tips. If you want to go for an international fellowship, you have to start very early. Even during residency, you should have an idea. So you can invest your time in publications in index journals. You can clear ICO and royal examinations. You should attend conferences and present papers or posters. So these all will give you an attractive CV to apply. And also you should have few contacts like in the through the CMEs and conference. So that will help you in getting the letter of recommendation. And always before joining one place, discuss with a current fellow of that institution so that you will get to know what is the current work pattern and whether it is whether you are able very good for you. And sometimes we can do a short observership in that same institution to see whether it is a valid one or not. Thank you and all the best.
Thank you, Dr. Soumya. That was really lovely and good to see your photos. So we can see you had a great time. And I think if anyone has any questions for Dr. Soumya, can go ahead.
राईट लेफ्ट मला नेहमी कन्फ्युजन होतं त्याला काहीतरी
Okay, so I think we'll take it to the panelists now. We'll give Dr. Soumya a break for some time. So, Dr. Anant, how do you see, like, if someone is planning for Australia for a fellowship, so what seems to be the best route? Is it what exams should he give, or how should the planning be? And you can discuss about how your fellowship, how did you go about?
Yeah, I'll actually try to explain in brief. So
Sure.
probably I would agree to Dr. Soumya that the preparation has to begin from the PG days. So if you are really aiming for an international fellowship, I think publications is one thing which I would really recommend the PGs to start thinking of right from the first year or even the second year. Second thing is try to build up your CV in some form or the other. Get presentations in national and state conferences. Make sure even you present posters and even if you are not able to get a paper selected in AIOS, at least make sure you get a poster selected. So these are the stepping stones towards it. Other thing which probably helped me was during my fellowship in Arvind, I made sure that I wrote enough papers. I was a part of case control trials. So all that actually helps. And whenever you apply for Australia, they have a single portal application on the RANSCO website. So the RANSCO website has links for fellowships and education. So there are five states, and each state has out of the six, 5 states offer fellowships. So it is mandatory for the institutes to display the vacancies. So keep a tab on the vacancies displayed every 15 days to a month. And probably what I realized is it's not that difficult to get into Australia or New Zealand, but we have to really make sure that we tick the boxes, what all they really assess you as a person. Because when I had applied, there were 32 applicants and there was one seat. And I didn't think that I had really an extraordinary CV, but probably I ticked all the boxes. I had done my first fellowship, I had done enough research, enough number of papers, and I was intending to come back to India and set up my own. So if you think if they feel that you are trying to enter Australia via the fellowship, probably they are not very keen to pick you as their fellow. But if you really make your ideas very clear that you really want to come back and practice where you belong from, so probably that is another thing. And don't shy away from applying. I mean, I had applied to a number of centers. So there is always, we see in football, when you hit the football post 50 times, once or twice you get the goal. Same ways you keep on trying. I had applied for Canada, I had applied for Australia, I applied for New Zealand, and ultimately it got through. So I think Australia has wonderful fellowship programs. They make sure that the fellow learns everything. So in probably 2.5, 3 years, I've done more than 1,400 vitrectomies, and they make sure that you do every surgery in the book. They make sure that you go to the next step, and the mentors actually do hand holding. They did unlearning of few things which I had learned. Probably they were not up to the standards they expected, and after that, and they make sure that you actually do things independently. So I would really encourage everyone to apply. With respect to the exams, they're not very keen about you having n number of degrees like MRCS, ICU, and all that. That's not a mandatory thing which is usually perceived by many people. So you actually can apply with your MS or even one fellowship, but you should actually fit into their criteria. I would like to take more specific questions if anyone has any.
Hello, good evening, sir. Hello.
Yeah, I can hear you. Please go ahead.
Yes, sir. Sir, I wanted to ask, right now I'm actually doing fellowship in cornea refractive surgery and was planning to go to Australia like after 2 years. So, do we have to give exams to practice over there and to settle?
To practice over there, you need to pass their licensing exam, which is also called as FRCO. So to apply for that, there is a hefty fees of about $10,000, I guess. And straight away, if you apply from here, probably they will charge you that money. They'll say, okay, you're not eligible, and they'll send you back the documents. So if you are sitting here and if you send the application straight away, it doesn't work like that. Probably if you're really thinking to work there as a consultant, maybe try it for a fellowship first. So that could be an easier route to get into the system.
Okay, sir. And sir, wanted to ask whether the exam, it's like it is how the exam is.
You mean the FRCO?
Yes, sir. Like
Yeah.
it's
FRCO is theory, then it is an OSCE and practical. It is divided into 3 steps. So once you are eligible and they have seen your logbook, so to go to that step of getting selected for exam, they make sure they check your entire training. Every FICO you have done is noted down. So documentation is very important. And once that is done, when they let you for the exam, then it's quite straightforward. But they need specialty training in each subspecialty for 6 months. So you'll have to produce a document stating that you work in pediatric ophthalmology for 6 months, retina for 6 months, glaucoma for 6 months. So those sorts of things. So that documentation needs to be done.
okay, sir. Okay.
Hello. So, ma'am, we'll come to you, Dr. Anusha, ma'am. So, we'll from Australia, we'll jump to UK for some time and give Dr. Anand little rest in his busy practice. And so Dr. Anusha has spared her time, and we really thank her for that. So, ma'am, could you tell us a little bit more about UK, like how to plan a fellowship and how can we work there? Because that is like very question which is everyone wants to know, and we really don't have a single answer, perfect answer. So I think you will be the best one. So please, ma'am, go ahead.
Sure, sure. First of all, thank you, Anuj. This is a great. I think it's a great plan to have such a kind of a workshop or a webinar, because many people, even I, had no clue as to how to go about, and we didn't have anybody to ask, or and then we had to do our own research and all that. So it's very good to have this because it helps postgraduates. So congratulations on that. It's a very great initiative. And Anuj has always been my. He was my what do I say? He trained with us at Agarwal's Institute. Our association goes back to, I think, 2012. So yeah, so it's amazing to see you back again here. Anyway, so coming back to the topic, fellowships in UK. So first of all, the couple of things that I would like to mention is, one is like Soumya mentioned and like Dr. Anand mentioned, you have to start early. You have to plan early. And if you have to go with the aim of settling abroad, then it is always better to start early on and go there early on so that you get it in the system. For me, it was very difficult because going there was okay, as in doing a fellowship was okay, but planning to settle down in UK seemed a little difficult because of many reasons, which I'll come to. And the second thing is, which Soumya mentioned, there's a slight correction I would like to mention, that for the GMC registration, you have to apply with a degree with your IELTS. The IELTS which you apply is valid for 2 years. So you get your GMC registration only if you have an eligible degree and if you have an IELTS. So the eligible degrees would be either if you have an FRCS, or you can go through PLAB or your FRCopth. And along with that, you need an IELTS. Even the MTI route, if you have a dual sponsorship, even that needs an IELTS to get a GMC registration. The second thing that she mentioned is the MTI is valid for 24 months, but there is also an option of switching from MTI to a Tier 2 visa, which is a Tier 2 visa is the one which you need to be, which is a work visa, and it qualifies for an ILR, that is an indefinite permit to, ILR. ILR. Oh, okay, IELTS. It is not IELTS, sorry. It is ILETS, which is the English proficiency test. So if you have your degree along with the English proficiency test, you can either do an IELTS or you can do an OET, either of the two, and then you have to apply to the GMC. So I hope it answers the question. Again, the MTI route, which is a dual sponsorship route, the MTI is valid only for 24 months, correct? But there is also an opportunity to shift from the MTI visa to a Tier 2 visa. That's what I was saying. During your course of fellowship in the UK. So the GMC isn't really worried as long as you have the registration and as long as you are associated with the trust. The GMC is not really worried. So you can even jump from an MTI visa to a Tier 2 visa with the GMC registration. And as long as you're associated with one particular trust. And the Tier 2 visa, if you're with the trust, they'll give it to you for how many hours you want. And then even through that, you can get your ILR, which is the indefinite permit to remain in UK and become a British citizen. So coming to what exams you need to give, well, what I did was I had an FRCS, which I had cleared during my PG. And I had to apply for the IELTS. So with the FRCS and with the IELTS, you can apply for GMC registration. But now, I think most of the people who want to go there, the preparation for FRCS and FRCopth is pretty much the same. So if my seniors had guided me, I would have probably done FRCopth rather than FRCS Glasgow. And then with an IELTS, I could have gone there, and that makes the route of settlement easy in UK. FRCopth is again FRCopth again is you have your theory sessions and you have practical sessions, and even there you need to show your proficiency in each subject. You have to show that you have been rotating in the each clinical specialty, and then you have a practical exam. So definitely there is a skill set. There's a skill section. Then you have a section on communication. So it's a little different than FRCS, but I don't think it's difficult. And now India also has a center for FRCopth exams. Earlier it didn't have, so you had to go to London to give the exams. But now I think even last exam was in Chennai at Shankar Nitralaya. So the FRCopth exams I think would be the best exam to give if you are still doing your post graduation and are looking at going to UK. So that gives you an extra leverage, because if you've cleared your FRCopth, then straight away you can start what is called a CSER. A CSER is a certification to enter into the specialty register. Only if you enter into the specialty register can you practice as a consultant in the UK. You can do fellowships, you can do, sorry? You can do,
yeah.
you can do fellowships, you can do all that. But if you are looking at settling down in the UK, then you need an FRCopth and you need the CSER. So the CSER is basically a certification which international medical graduates have to provide. And that is basically a 1,000-page documentation. So you have to, there are different levels, like the competencies are outlined, and you have to provide competencies in each and every level. For example, in communication, case discussion, the fact that you have rotated in all the subspecialties. So you need to show that. And then you have to have there are minimum number of surgeries also, which they have outlined. So you should have had done temporal artery biopsies, selective laser trabecular SLTs, and then you should have done penetrating or assisted in penetrating keratoplasties, 300 cataract surgeries. You should have done 20 squint surgeries. So there are a lot of these things that come there, 15 oculoplasty procedures. So that is also outlined. So you have to produce a certification for international medical graduates who have not done their FRCopth there, that you have done all these. So either you do it or get somebody to certify it for you, but this is how you can apply for a CSER and or prepare for a CSER. And once you have your CSER and you have your FRCopth, then you can apply to the GMC for entry into the specialist register. Once you have entered into the specialist register, then you are done. You can practice as a consultant in the UK. Otherwise, the posts that are open for a non-consultant are either registrar posts or a specialty doctor posts or fellows. So these are things that you can look for in the websites. You have a lot of websites. You have the NHS website, you have the BMC website, British Medical Council website, which gives you the vacancies. And if you have your GMC registration, you can still apply to all of this. Another important factor here is that when you have to apply for this specialist register, you need all the documentation has to be within 5 years. So if anybody is planning to go to the UK and they're doing the post-graduation or their fellowship, it is my sincere, what they really need to do is collect all the surgeries that they're doing, maintain a log of what they're doing. Documentation is extremely important. Even though we had it from RP Center in AIMS, whatever fellowship I had, whatever experience I had, was much longer than 5 years. So whatever you are doing, your fellowship or your whatever you're doing, your clinics, the cases that you see, or the rotations that you have, then everything has to be documented and keep collecting. So whatever you're planning, suppose you're planning for a fellowship in the UK or you're planning a fellowship elsewhere, just see what all paperwork needs to be done and start collecting evidence right away. So all this will help you when you go to the UK, if you're planning to settle in the UK lifelong, to get your CSER done. CSER is not the only route to settle down in the UK. You have something called a CCT, which is a certification course in the UK. There, the ophthalmology is for 7 years. So if you've done ophthalmology from any other country, you don't have to start from ST1. There are vacancies that come up. So you can start in the 3rd year as well, and then go all the way up till the 7th year. And then you're directly a consultant. So that is also a way. If you don't have to do the CSER and if you don't want to do the certification, you can wait for these ST3 job opportunities and then start but you'll have to do your ophthalmology all over again, like 4 years of training in ophthalmology all over again. So yeah, so that's about it. The way I went was I had cleared my ICO fellowship, so I had my ICO degree, and then I had applied to Moorfields during COVID for the degree for a fellowship in ocular oncology. That is another thing that I would like to tell the postgraduates, that they have the ICO website has a list of countries to which you can apply. But it is not so. You're not restricted to apply only to those countries. If you identify a mentor from any other country and you want to apply, you can first talk to the mentor. If he agrees to accept you as an ICO fellow, you can take a letter from your mentor saying that he's ready to sponsor you. And then you can just write to the ICO and the ICO gladly accepts it. So it doesn't really matter whether it is from the list or it is outside the list. You can do anywhere. As in, you can do anywhere. So I had applied to Shields. I got a positive reply from Shields. But because of COVID and the time frame that they had given me, I could not go. But Shields is not mentioned in the ocular oncology ICO list. Moorfields is not mentioned in the ICO list, but again, I got a positive reply. So Moorfields finally worked out. And then while I was doing my ocular oncology, before going to London, I had my GMC thing sorted out. So I went for my ICO fellowship, and then there was this advert for the long-term fellowship. So with my GMC registration, I could apply for the long-term fellowship, and I continued as a long-term fellow in ocular oncology. So I was in ocular oncology for about a year and a half, and that's it. But ICO is generally the condition is that you have to do ICO and then you have to come back. But then again, we wrote to the ICO saying that I would like to do a long-term fellowship. Would you be okay with it? And the ICO said, yeah, please go ahead. So there are no hard and fast rules. We think a lot in our mind, okay, only this is possible, only that is possible. But then things are possible out of what is mentioned in the ICO website as well. Plan early, maintain your log, your documentation, and do your homework on what is required and keep maintaining the log. I think that is what is most important. Start gathering evidence right away if you're going abroad. There is a pattern on how you have to gather evidence. So it is mentioned on their website again, on the GMC website again. You have to maintain the log as in whether you have done the case yourself or you have assisted the case or you have observed the case. So there is a way. So if you're maintaining a log, maintain it in that particular way. It will help you in long term. If there are any specific questions I would like to, this is very a broad idea, but if there's anybody who's specifically looking at going to the UK and any specific questions, I'll be more than happy to answer.
I think anyone from the audience, because ma'am has given a very extensive this, and she has touched the ICO fellowship also, which a lot of you were asking. So one thing I feel is you don't need to clear the ICO exams even to apply. Even if you're not cleared, you can still apply for this, though you may have a less weightage, but you can still apply.
No, the ICO exams you should have cleared at least the basic and the clinical. Advanced is not required. Like even if you've not cleared the advanced, it is all right. But you should have cleared your basic and clinical at least. Otherwise, the waiting list is so long. I think you can apply, but the waiting list is so long that you will not get preference.
Yeah. So if anyone has any questions, please go ahead and please turn the video on when you are asking questions so that we can know whom we are interacting with.
Ma'am, I have a question. Dr. Amol Sir, ma'am, amongst the 3 degrees, FRCS, MRCS, and FRCopth.
Amol, you have to be a little louder.
I can't hear you.
Can you hear now?
Yeah, much better.
Amongst the 3 degrees, FRCS, MRCS, and FRCopth, which is more preferable for UK?
If you're planning it settling down in the UK, then definitely FRCopth, because that is mandatory. That is mandatory for you to get your to go for your consultancy. To apply for the specialist register. So if you're planning to go and give any of these exams, then FRCS and MRCS would help you get the GMC registration, which would help you sort of gain some kind of a fellowship or something there. But if you're preparing, then I think FRCopth is something that you should give.
And suppose I want to do only a fellowship and return to India, then which exam would be better?
So that what Dr. Soumya was mentioning, for that, either you can give your FRCS. So my point is that the preparation for FRCS and FRCopth is almost the same, because I was also trying to look at giving FRCopth. I remember asking Anuj also for some books on anatomy. Anuj, mujhe, if you can get hold of this for me. And he did send it across to me, like Snell's anatomy and all that. So the preparation is pretty much the same for FRCS and FRCopth. Just that only the clinical part, there's a little bit difference in the OSCE. So if you're really preparing, then why not prepare for FRCopth? So there's nothing much different. So another thing, if you're doing a fellowship and coming back, either you can give either, FRCS or FRCopth. You need to give your English proficiency test.
Ma'am, I can't hear you.
Either the FRCS or the FRCopth and the English proficiency test, and then do your fellowship. But you can also, even if you don't have these degrees, you can get through the MTI route, which is a dual sponsorship route. You don't need to have any of these degrees, but it is a long drawn process. It is a very long process. It takes about a year and a half, all the paperwork and everything to happen, where you need to have a sponsor from India and you have a sponsor from abroad. All of my friends who had come, a lot of my juniors at Moorfields were from, one of them was from Arvind Eye Hospital, who had done their PG from Arvind Eye Hospital. So through Arvind, they got an international sponsor, and then Dr. Kim decided to become the regional Indian sponsor. So like that, you can go, that is called the MTI route, or the Medical Training Initiative. And through that also, you can enter the UK for fellowships. So you don't have to have these exams if you have a dual sponsor.
Actually, ma'am, I have cleared ICO exams, like till ICO clinical sciences I have cleared. So can I directly go for FRCopth, or I need to clear ICO advanced?
ICO and FRCopth have no relation. I think that is for the FRCS. If you clear the ICO advanced, you get an FRCS degree as well, or something like that. Or you're eligible to apply for FRCS. But that has no bearing on FRCopth. FRCopth, you have to start from scratch.
And ma'am, amongst the FRCS, which has more weightage, like FRCS Glasgow or FRCS Edinburgh?
FRCS Edinburgh.
Okay.
FRCS Edinburgh, definitely, it has more weightage. It is slightly more difficult to clear than FRCS Glasgow. The preparation is more intensive, and it is FRCS Edinburgh is more or less like FRCopth, whereas FRCS Glasgow, the practicals is not so intensive. You just have an OSCE, and then there are a couple of stations of OSCE, that as far as I can remember. And you have different clinical stations where you're given cases and you have to pass in all the clinical stations. But in FRCS Edinburgh and FRCopth, you have more practical sessions on communication and how to break a bad news and stuff like that. So FRCS Edinburgh is slightly more difficult, but it has more weightage.
Ma'am, as a PG degree, and ma'am, as a PG degree from India, which degree has more weightage, like MS, MD or DNB?
I think it is, I'm not sure about that, but on the GMC website, as an MD degree, you mean? MD degree to either of the two, that doesn't matter, as long as you show your clinical experience. Whatever you've done, it has no weightage, because this FRCS is like giving flab and going. So they consider your FRCS only as your primary ophthalmology degree. So your MS or your DNB is not really showcased anywhere. So you can be you can have a DNB, and if you have an FRCS, even that is fine. If you have an MS, so the PG degree doesn't really matter whether you are MS or whether you are a DNB. You have to go there with a UK degree. So that is the FRCS thing. So it is irrespective of what you have, whether you have an MS or DNB. If you have FRCS, then that's it. They don't even check where you've done your. So when you apply for the GMC registration, they just ask for your undergraduate, the college that you applied from, and they have a list. You have to see whether your college fits in that. So that is a list of recognized colleges by the GMC. And then the post-graduation, you have to do FRCS. You have to show a UK degree. You cannot show an Indian degree for post-grad.
And ma'am, you have talked about surgeries and procedures that you have.
Your voice is breaking, Dr. Amog.
Hello, can you hear me, ma'am?
Yeah.
Ma'am, you have mentioned about logging all the surgical work and all the OPD work that we do during. I'm doing a fellowship in Bitter Retina, so I have maintained my logbook in a handwritten format. So, is that acceptable, or we need a more like in a Excel sheet or something like that?
So what I would suggest is it is good that you have it in a handwritten format, but I would also suggest you to go through their website as to what the requirement is. Like you have there is a particular way in which the log has to be maintained. It is generally an e-record, but even a handheld document is accepted these days. But whatever it is has to be ratified by your mentor at the end of your fellowship that this is what you have done, signed, stamped, and dated by your mentor. So that is acceptable, but they generally look at an e format, which is more acceptable. Even this is acceptable, but what they generally look forward to is e format. They have the number of the patient, the date of birth, and then they have the diagnosis, and then what surgery you did, when you did, what complications you had, and whether the surgery was done by yourself or whether it was or were you just observing it, or were you doing it under supervision, or whether you were teaching somebody else. So all that. So there is a particular format for the UK, especially on how to maintain data. So it's given on the website. I would suggest you to just go and see how to collect in data for Caesar, and then this comes up on the thing, and then they tell you how specifically to gather data.
So,
and it has to be signed by your mentor. And
so if it's just handwritten, signature and stamp by the mentor is a sign of authenticity, right? It will be accepted.
Yes.
Okay.
Yes. And after all this, what they also appreciate is like in UK, and I'm sure in other countries as well, they do something called an audit, which is like a quality check. So if you've done these many VR cases, so at the end of the day, you can end of your fellowship, you can probably analyze how many cases you did, what are the complications you had, and how you managed them, and what you learned from them, sort of reflecting on them, like retrospectively. And then so what is the percentage of resurgery? So when I was a consultant, I gathered all this data, and then I did a little bit of an audit on how many resurgeries, what was the visual outcome, and all that. And then like a small audit, and what you learned from it, how did it improve your practice. So that also, whenever you apply for fellowships, they ask you in the application form whether you have been part of any audit or anything small, any small thing. Like for example, these audits are something that we generally keep talking about, but we don't document it. So it's like for example so for example, patient waiting time, like what was the patient waiting time and what you did to improve anything that improves the quality, or you were checking the when the drops were opened and whether all of them are marking the date that it was opened and discarding it when the medicines got expired, something like that, something as simple as that. But that is also an audit, that is also counted as an audit. So these audits also add to your experience, and like Dr. Anand mentioned, any publications that you have definitely give you an extra edge over other candidates.
Okay. Thank you so much, ma'am. Thank you for answering my doubts.
No problem.
Hello, ma'am. This is Dr. Ashwini, ma'am.
Hi, Ashwini.
Yeah, I wanted to ask a question about ICO fellowships, ma'am.
Mm-hmm.
While applying for that, there is a document that has to be submitted, and it is called the Department of Ophthalmology Chair's recommendation.
Correct.
But I don't
present
work
chair and
in
previous chair.
No, ma'am, but I don't work in any institute. I'm a private practitioner. So,
Okay.
what do I do about this form?
You work in a private institute, but is it your own clinic?
Yes, ma'am, it's my own. So, what can I do
Okay.
about it?
So did you, were you, what do I say? Did you do a fellowship from somewhere?
No, I did my DNB
Hmm.
and I started my practice. And for a short time, I was a consultant in an institute.
So you can take a letter from that institute and you can use that as a chair, as a present chair. And you can just mention that currently I'm working as, I'm having my own clinic sort of thing. So you can use even one record is enough. But again, I would like to just tell you one thing. I mean, again, it is not to discourage you, but the idea, actually not. I mean, I don't think that point is valid anymore. So yeah, you can use your certificate from your previous institute and provide that itself. It is acceptable. You have a certificate from the previous institute?
Not this particular form, ma'am. I have not got this particular form filled.
So you
Certificate as what?
Yay form. I was talking about this form only. You can ask one of them, whoever was heading you or whoever is your HOD or whoever, to fill this form up for you. Or yeah, DNB, wherever you did your DNB, if they can fill up this form. They will not check whether abhi, wherever you are, is it from there or not. They just need 2 letters of recommendation. That's it. So you with whoever you've been associated with. So you can get it done from anybody. Like DNB, even if you have somebody from DNB who can attest it for you and say that, I mean, give you an LOR, and somebody from your institute. You just need 2 letters from somebody whom you've been associated with.
Okay, ma'am. Yeah, got it. Thank you, ma'am.
No problem.
Hello, good evening, ma'am. Ma'am, I'm Gaurav.
Hi, Gaurav.
Hi, ma'am. I'm currently a JR3 resident. Ma'am, regarding FRCopth, ma'am, what all do we need to study, or could you recommend some books or something? Is there an online platform or any other thing to study for FRCopth?
There are some groups on Telegram specifically for FRCopth preparations, and the study matter, the content is easily available on the website. Like if you have to prepare for the FRCopth, there are websites which tell you which books to study and what to use. So for every step, so you have FRCopth 1, you have part 1, part 2, and part 3. Part 1 is more about your preclinics, and then you have optics and refraction, which is a part of the FRCopth part 2A, and then you have part 2B, which is like the written, and then you have part 3, which is the practical. So for all these 3, you have, like I said, there are groups on Telegram, and there are resources on the website as well. For collection of books. And I also, like, if you're personally interested, I could give you some contacts. You can just take my number and you can just message me, and I could put you on directly to people who have just recently cleared their FRCopth exam. In fact, whom I had contacted saying that I am going to give my FRCopth, but I never did. But yeah, I can put you on to them. They can help you directly if you're going to clean, if you're going to give the exam.
Yes, ma'am. I would like your number or something.
Yeah, I will share it with you.
Yeah, Anuj will share the number with you.
If anything is there, you can this. So, I think Dr. Anand, do we have you? We'll give ma'am a breather because I know she's busy as well. So regarding Australia, do you feel it is important to clear ICO or FRCS, or how is the sponsorship? Is it like we can directly go through a recommendation from our chair, or what is the best way if we are planning for even a short-term fellowship?
Surprisingly, I haven't seen Australia accepting, as far as I know, accepting ICO 3 months. I don't know why, but it may have been happening. Probably I'm not aware. But if they really want you to, they'll have at least you for an year. None of the degrees, none of the exams, ICO and all, probably even those my mentors are even the other guys even never knew that ICO kind of thing fellowship existed. 3 months of. So probably they really need your basic licensing exam, either MD, MS or DNB from your country. They get it cross-checked. And most important thing is they want you to train in a particular specialty. The good thing about this thing is they make sure they contact your referees. So both my referees from my PG, from my research fellowship institute were contacted on phone or either on email, and they make sure they ask particular questions about you as a person. They really don't want you to know a lot of retina or something like that, but they really want you to know that you will be capable enough to handle their system, their patients, how patient you are. And I think referees really play a very big role as far as I understood the system. And with respect to the remuneration, which one of this thing is questioned, probably Australia gives one of the best stipends or best pays in the world. The per capita income is quite high. So I think with the fellowship, the advantage of this fellowship is you save enough money so that you can come back and start your own practice. I think that is one good thing about fellowship in Australia than compared to Canada and New Zealand. And there is no mandatory thing of to as like UK to get your none of the other fancy degrees. So you straight away after your fellowship you can apply. You can still get into it.
Okay, and do they have short-term courses like where we can go for 2 to 3 months? Like
No, I haven't heard about it because the process itself to get into Australian Medical Council is pretty tedious. Probably it's one of the most the paper wise it probably takes about a year. So if you are thinking to go to Australia in 2026, then you should start now. So they take an interview an year in advance. The paperwork goes on almost for a year, and there are no short-term courses I have heard of in neither on the website nor on any of the PGs or fellows talking about it. So it's at least a year.
okay.
Sir,
Sir, what is the duration of retina fellowship in Australia? Any of the states? Like
No, I
duration?
think you should give others opportunity also. Go ahead. I was just joking. Yeah.
Sorry, I'll answer Dr. Amok's question. So the minimum duration is 1 year, and they can extend it. So in my case, I did actually the fellowship started with 1 year. It got extended to the second year because I was doing a phase 3 trial with the institute and I was working with one of the project with NASA. So it was a very major project. So they extended the project to 2 years. And because of COVID, none of the other fellows could come in. And I couldn't come back to India. So it was extended to 3 years. So probably 1 year is a good time. But in the second year, I got a lot of hands-on and a lot of independent surgeries. So 1 to 2 years probably is a good time to do.
So 1 year would be enough, sir, to learn.
I think so. If you have a basic fellowship done in India, I think 1 year is quite enough to do. There are some people, what they do is they hop to the other institute. Say, I did my fellowship from Perth. One of our candidate I know, he hopped from Melbourne to Sydney to get an experience with few other mentors. He wanted to do some research in genetics. So he hopped from Sydney to Melbourne with Robin Geimer and he did fellowship in genetics. So you really have to carve out your own way. There is no fixed thing that this works. But surgical wise, yes, you get enough number of surgeries even in 1 year. You should end up getting at least 300 to 400 vitrectomies by the end of 1 year.
Sir, any book that you will like to recommend to give those exams, the theory, the OSCE?
You mean the Australia ones?
Yes, sir.
Sorry, probably I never went to that path. I mean, their exams, whatever my registrars used to write, probably out of 10, 2 used to pass in the first go and rest 8 used to keep trying. So I'm not sure I can actually get one of the email IDs of a few of my registrars who have passed. I don't see there is any specific book about it. Probably I'll get in touch with you. I can send the email address to Dr. Anuj and you can get it from him. There's no specific book as far as I know.
Okay, sir. Okay. Thank you, sir.
Good evening, sir. This is Dr. Payal. Hello?
Yeah, please
Go ahead and you can start your video so that Dr. Anand can know whom he's interacting with. Yeah.
Yes, sir. Good evening, sir. Actually, I have completed my fellowship in FICO refractive surgery 2 years past, and I am currently practicing as a consultant. So I just wanted to know, is there an option for refractive fellowships in Australia? Because I was unable to find anything on their website, so I was just wondering regarding that.
Actually, if you ask for a pure refractive, I don't think there is any because all these fellowships are in public hospitals like government medical colleges in Australia or they are government hospitals. So you will have multiple roles. You will be seeing general patients, you'll be doing FICOs, you'll be doing refractive work. So specific refractive, I don't think so, but
So
probably
would they consider me without a cornea background if I apply for a cornea fellowship?
it really they would really do. I mean, you should be able to. You should be at the right time at the right place, and all depends upon how many other fellows, other people have applied. What is their background? How strong your referee recommending you? How
Hmm.
strong they feel that you are going to come back and make a difference in your own society. Those all things matter. So I don't think you should get discouraged that you don't have a fellowship. I think there is always a chance. All you need is just one seat.
Yeah. So, sir, what is the exact website or the pathway to go about this? Like,
So Ranzco, RANZCO, if you Google,
okay,
you'll be able to get that website. It's a very self-explanatory website. So there
all
are
right.
tips about education and fellowship. So
Hmm.
anytime you go, even now you open, you'll be able to see if your fellowship's opened. So make sure you
Okay.
apply in a proper CV, your
Hmm.
detailed CV with your referees, their contact emails and their phone numbers. Make sure
All
you
right.
make your referees aware that they might get an email from so and so institute. And please
Okay.
request them to check spam, because sometimes these international mails go to the spam folders, because my selection letter had gone to a spam folder itself. I was
Okay.
unaware of my fellowship selection for 8 days. And one of the
Oh,
this thing called, are you interested in, because we have selected you, and you did not reply to this thing. So, and even our seniors, some of the seniors will never check emails. So please request them to keep checking emails, and probably that is a good way to, and if they can recommend you highly, then that makes a lot of difference.
okay, sir. Thank you so much.
Anant, second thing, what a lot of residents they ask is, what is difference between a cover letter and a CV? Because
Sorry, say that again, please. I missed that.
the cover letter, because a lot of fellowships will ask for a cover.
Okay. So one is a recommendation letter written by your mentor. So he'll write, I have been knowing Anand from these to these days as a fellow in retina. He has been keen to learn about clinical this thing, and probably one of my mentor had written, I got to know it retrospectively, that he had written about an incident where how I made a difference in the during that particular incidents by working differently or doing something. So if he writes an elaborate covering letter about a page or something, about the qualities, about even the this thing which he has to improve, an honest letter. So probably that helps. That would be about the cover letter. CV, I think you should write about your education, then about your thesis, about your publications, about your presentations, about the community work, about the research you have done, any book chapters if you have written, and in the end, it would be the references. So it's a standard format which these points, if they come in, probably that explains about a candidate in detail.
I think that's good. Dr. Soumya, are you there? Dr. Soumya, I think.
Yes, sir.
Yeah. So how was your fellowship? Was it a sponsored fellowship, or did you apply on your own? Can you give us a brief about it?
I did observership in more fields, so I directly applied to their website. They have a course coordinator's mail in the mail, so I directly applied. And when I applied, it was COVID time, so there was a waiting period. So later they responded.
Okay. And you needed any reference, or how was it?
They asked for a letter of recommendation,
Okay. So
and the visa also we have to get by ourselves.
yeah, absolutely. So I think most of the questions have been cleared. If anyone has any doubts, please go ahead, because our speakers and panelists are really busy, and we need to let them go, because
There are some questions in the chat box, Anuj. I think we've answered most of them, but if we have not answered any, I think we can take them.
Good evening, sir. Sir, I had one question.
Yeah, Rutusha, you can start your video. So, and whom do you want to ask the question?
Sir, I wanted to ask my question to Anusha ma'am. Ma'am, my question was regarding the MTI route. So, is there a specific website for that, or like how do we go about the MTI route?
Yeah. You can just, there is not a specific, there's no specific website, but there is if you just Google MTI route for UK fellowships, or you can write medical training initiatives. Isn't that so, Soumya? Even Soumya will be able to guide me on that. But there is a specific, you can write medical training initiative UK, and then you get the guidelines. There's no specific website, because that is or you can write how to apply fellowships in UK, how to go about fellowships in UK or something like that, and then you get these three things, like through ISGMC registration or the MTI route. So yeah, but there's no specific website as such, to my knowledge.
Okay, thank you, ma'am.
Hello, good evening, ma'am.
Hey.
Hello.
Hey.
Harsh, you can start your.
Can you please elaborate on the
On this? Sorry, I didn't get your question.
Ma'am, can you please elaborate on the ST3 route that you are saying?
ST3 route. Okay. So the ST3 route is also called, again, this is again extensively available on the net. You have, it's called the CCT. And the two options for a international medical graduate to practice as a consultant in the UK. You have CCT and you have CSER, which is CESR and CCT. So CCT is where you have you apply through after having done your ophthalmology fellowship, or if you have some work experience in ophthalmology, there is also criteria for that. And then you just look out on the NHS websites for such posts. The problem is that the ST3 vacancies don't come up very frequently. It happens only if an ophthalmologist who has started from ST1 has to drop out for some reason, or they want extra candidates. If there are international medical guys, they want extra candidates, then they sometimes open it up. So it's not always available. CSER is something which you can do anytime. It's at your will and disposal. But the other thing is subject to availability from the side of the NHS. So when you keep looking at the NHS website, occasionally you might see that there is a post for an ST3 at a particular trust. And then you can apply for it. And if you get selected, you can just continue with your ST. So there are 4 years of training, 5 years. So ST3, ST4, 5, 6, 7. So 5 years of training. And once you finish that, then you can directly become a consultant. Because during that, have they stopped direct ST3 entry? I'm not sure, Rachna. But when I was there, it was still there. Like we could still apply to ST3. One of my friends just recently got into ST3 in Gynae. So I'm not sure about ophthalmology. So Rachna is sharing some probably latest input that ST3 they have stopped of late, which I'm not aware. So when I was there, which is about 1.5 to 2 years back, my friend gained entry. She went into Gynae at an ST3 level. And so I don't know. They say it has been stopped. So you could still check. You could just check with the GMC once, just to be sure. But as you give your ST3, the initial format was when you get into ST3, then you keep giving your FRCopth exams. And then when you're out, you have all the competencies required and you have your FRCopth. So you are a consultant already. You go into the CSER, you go into the register directly. You don't have to do your CSER then.
Good evening, ma'am.
Good evening.
Can you start your video and introduce yourself?
I'm not able to start my video because of a technical issue. My name is Mansi.
Hi, Mansi.
Yeah, hi. So I wanted to just know who should do an international fellowship? Like, why should I consider one?
Yes, okay. Oh, why should you consider an
Yeah.
So there are 2-3 things here. If you want to experience how things work abroad, it'll give you an international perspective to things. You will be able to have international connections later on for like if you're an academician and if you are interested in presenting in conferences and all that, so if you publish papers or do research from their end, there are more chances of your work being accepted because they are from reputed international institutes. I mean, this is putting it very frank, but then you also have international connections, and if you come back to India, it gives you added recognition, gives you an added record that you've done an international degree. So many places they prefer people. I know of my juniors from AIMS who have gone and done, and they're working in reputed institutes. But then their the pay package speaks. It's slightly higher than what any ordinary candidate would receive. So yeah, it gives an extra edge. Plus, if you want to explore any further opportunities abroad, a fellowship will give you that edge. Like Dr. Anand said, if you do a fellowship in Australia, then you can look at doing something there elsewhere. It becomes difficult for you to apply from here. Likewise, in the UK, okay, also, if you wanting to settle down in the UK, then if you do a fellowship in the UK, then it gives you an extra edge over others, and it helps you settle down in foreign countries easily.
Okay. And ma'am, I'm currently a postgraduate student. So should I do like a fellowship in India and then go abroad, or should I just go abroad if I want to settle there?
I would suggest if you have your exam, if you have your all these fellowships, they ask for some kind of expertise in that particular field. So even when you are applying for Cornea fellowship, or even if you apply, if your postgraduate has been very solid, like if you've got super hands-on experience in almost everything, then you can directly consider going for a fellowship. There's no harm, like Dr. Anand said again, there's no harm in applying. Keep applying, and then you'll automatically get to know what they require. But as far as I understand, a fellowship already also gives an extra edge. It gives you some, like again, Dr. Anand said, it ticks some additional boxes for them. So if you have some expertise, then in that particular field, then it is definitely an added benefit. So you can definitely apply after your postgrad. There's nothing stopping you from doing that. But if you have a fellowship, then it'll be easier to get a fellowship there. But nevertheless, you can apply.
Okay, thank you, ma'am.
Yeah, Dr. Soumya, are you there?
Yes, sir.
Yeah, so because this is one very what do you say, common question when people ask, how good is an observership program? Like sometimes it happens for people who are applying for short term and who have already done a fellowship, as ma'am said, they want to get that international edge. So how good is it, and how was your experience? Could you share? Because
when I went, I finished my fellowship and I worked for nearly 6 months to 1 year. So I was knowing what I was lacking, what I didn't get during my fellowship, what I need to see more. So that actually I was able to attain from there. And even after fellowship, when we start practicing, only we know what all things we are lacking, what all things actually how to manage patient differently. So that will help you. Even from when I went there, even the consultants were like treating us differently, because most of the observers along with me was residents or medical students. So they will give a extra care for us because we have done a fellowship and we know about the subject. So I think after doing a fellowship, if you cannot go for a long-term fellowship in internationally, observership is a good idea. But before choosing an observership, you should know like whether what you are looking for is whether they are able to give you what you are looking for. So choose the place properly. So that is my take-home message.
yeah, I think we have to be clear what we want. It is, we cannot be just like we want an international fellowship. If we are very sure, I think it makes a difference in our CV also, and there are more chances of us getting accepted because that is what they look for. Rather, what we have here in India, it's more like a diffuse. We don't really focus on one particular thing in a specialty. So I think that was great. I think we can take just one more question if anyone has, or we can just call it a day. And if any questions, you can always put in a message and we will definitely get reply from the experts.
Hi, sir. Audible?
Yeah. Go ahead, little louder.
Yes, sir, this Gunjan here. Sir, I wanted to know about the details. Like, I have completed my PG. I'm currently working with a registrar in Mumbai. I want to know about ways about how to move about and settle in Canada.
Okay, so we have a question about Canada. Does anyone know or can help?
If it's okay, can I answer it?
Yes, please.
So I had my friends and colleagues from Canada whom I'm really in touch with. So Canada, similar to Australia, straight away doesn't pick you as a consultant. So there are very good fellowships in Vancouver, Toronto, which offer a lot of hands-on surgical. So probably it will be a British Columbia. Vancouver has a very good fellowship program for all the specialties, which even I had applied. Once you get into it, you can then, if your mentor really wants you, then he'll make sure that you write their exam, and then you can actually become a consultant there. If you are considering, if someone is considering,
Sir,
sorry.
Sir, I'm over there. So, like, only the fellowship is, like, what I do is I just have to repeat my, like, I want to know whether I need to repeat my residency again or not.
All depends upon what experience you had in your training. So if you had, as Anusha ma'am explained, if you had enough number of FICOs, enough number of subspecialty training, then you really won't need to, but make sure you have a log of it, because without log, if you just go and say I've done 1,000 FICOs, they won't consider. So you should have a proper log in a proper format, patient's name, pre-op vision, procedure, post-op vision. Say you do 100K surgeries, how many complications you had, how did you manage, did you have a PCR or IL drop? So all those things you have to have in a written format. If they accept your logbooks, then they might ask you to write the exam straight away. If they feel it is not enough, then they'll ask you to few rotations. Say pediatric rotation for 6 months, something like that.
Can you exam requires
I think Dr. Gunjan is traveling. So maybe you can just put in a message, and then if your answer is, if you don't have any more queries, maybe you can put in a message, because I think we're getting a lot of disturbance. If the question is answered or you have any more doubts, Dr. Gunjan.
All right, sir. I'll in the message, sir. Thank you. Thank you so much.
Okay. So anyone else, or we'll just.
I have a question. I just wanted to know how to work in Ireland after finishing our post-graduation in India, sir.
Ma'am, you need to unmute, Anusha ma'am.
Yeah. Yeah. Am I audible now?
Yes, ma'am.
Yeah, so it's the same process. The GMC is so Ireland, Scotland, and UK. They all have the same. I mean, you have to follow through the same process only. You need the General Medical Council registration, and the process is pretty much similar. The exams and certifications and all is pretty much similar.
Thank you.
Again, it depends on which part of Ireland you are, because North Ireland and South Ireland. North Ireland is part of UK, but South Ireland isn't. So, but all of them are, they follow the same, the GMC, and it's pretty much the same what we just discussed.
And can we give the exams while doing our post-graduation only, in case if it is like FRC, Ophthalmology?
You must give it then while doing your post-graduation, because after that, going back to anatomy and all that is not very easy. So you must give it as and when you have your basics cleared. You should give off the respective exams and just keep clearing them. Give them as early as possible in life.
Even
you so much.
doing retinoscopy is important.
Exactly. I mean, it's very difficult at my age to go back to retinoscopy and think what we used to do with the Jackson cross cylinder and all that, unless you're routinely doing it in your practice. So whenever you're learning it, do it then. Hit when the iron is hot. Yeah.
Ma'am, one last question, ma'am. Do you have any information about UAE or United Arab Emirates?
UAE, I was just looking at for consultancy, but usme to you have to clear your DHA, na? You need to clear your DHA, which is a licensing exam. And then I don't know, I have no idea about fellowships, but this DHA is the license that you require to practice in Dubai. You can either go on your own, or you have people like agencies who coordinate the entire licensing exam for you. You have to submit all your certificates, and then again they also have a surgical log which you have to submit over the last 2 years or something, that whatever surgeries you've done and whether you've had the same thing, complications, whether you've had, and how many surgeries you've done, whether you assisted or performed independently. And then you have to apply for the DHA exam. So that's pretty much. I have no clue, no idea about fellowships. I was just looking at some options there as a consultant.
Thank you, ma'am. Thank you so much.
I think if that's it, then we can have one more session. We will let go of our experts because they have really spared their time, and it was really because we have had a very good response, and really I appreciate Dr. Soumya, Dr. Anusha, and Dr. Anand to be so supportive and take each and every question. And really, I think I also should think of something, and I'll also be messaging you. And so
You're a boss already, Anuj.
thank you all. And if anyone feels that they have some doubts, please put in a message, and I'll definitely put it across. And you will definitely get your queries solved. Okay. And
Anuj, can I say something?
yes. So we have Dr. Nayana Podar. She's a professor from Nair Medical College. And yes, ma'am, please go ahead, ma'am.
Yeah. I should appreciate the initiative you have taken, Anuj. Excellent. I wish we had some programs like this. I wouldn't have been in Nair now. All your webinars, I know I take out time to, attend it. And I'm really glad that all the mentors, Anand, Soumya, and Anusha, they really spoke well, gave lot of information to the students. And I hope all our students who are interested and who ask questions will really benefit from this. Just keep up this good work, Anush.
Thank you, ma'am. Thank you for attending and giving your encouragement to all of us, ma'am.
Can I say something?
Yes, Anant, please.
Really, I mean, I really echo Naina ma'am's words, and it's a really very good platform which Anusar has created for the youngsters to know. Because when I reached Australia, I felt, okay, this is not that difficult. Sitting here, we feel it is, can I get selected? Like, we keep on having questions in your mind. All you need is just one seat of fellowship. And once you go to that platform, it's really a life-changing experience, not only academics wise, not only surgically, but as a person, it really enriches you. You tend to interact and mingle with a lot of cultures. You tend to work with a lot of great human beings who are so humble, so down to earth. And of course, financially, these fellowships help you. So really don't look back. I would encourage everyone to apply for these institutes, and they really change your life. I'll share my email address and phone number with Anuj sir. Sir, please feel free to share with the group. And if anyone has any problems or any issues with applying, they can directly contact me. Thank you.
That is amazing, and thank you all, and let's hope we meet again, and even with more international stars. So once again, thank you, Dr. Soumya, Dr. Anand.
Thank you.
Dr. Podar ma'am and Dr. Anusha ma'am, and we'll take all your questions.